you one of the many people who still think that COVID-19 does not exist? Well, it's about time that you change your mind because COVID-19 is real.
Coronavirus disease 2019 or COVID-19 is the most famous infectious disease nowadays. It is what we call our invisible enemy. It originated in Wuhan City, Hubei Province, China. It was initially reported to the World Health Organization on December 31, 2019, and it was soon declared a global pandemic on March 11, 2020.
Anyone of any age and any color can possibly be infected with COVID-19. But the question is, how can we get this virus?
First and foremost, you can get this virus when you go out of your homes and interact with other people, most especially when you are too close. Sneezing or coughing. When an infected person sneezes or coughs and you are in his 6 feet range, then you can breathe in and catch the droplets which are infectious. Shaking hands. We all know that hands are our body part which we often use. When we come into contact with the hands of an infected person, there is a high possibility that we will also be infected with the virus. Talking or singing too close. Droplets are spit out in the air when talking or singing, and these infected droplets can potentially infect you when you catch it. Touching infected surfaces. Infected surfaces are the ones that were touched by the infected persons. And when you come into contact with these infected surfaces and you touch any part of your body which can be an entry into the inner part of your body, then you can catch the virus.
Anyone infected with the virus may or may not experience its signs and symptoms. But the question is, what are its signs and symptoms?
Most common signs and symptoms include fever, cough, difficulty of breathing, loss of smell, loss of taste, runny nose, and sore throat.
Most people infected with the virus will experience mild to moderate respiratory illness symptoms, and they will soon recover without requiring any medical treatment. However, some still will experience very ill and very strong respiratory illnesses. That's why they will require special medical attention. If you experience any of these signs and symptoms, what would you do? Or how will you handle it?
Stay at home or isolate yourself. Monitor your symptoms. Stay hydrated. Consult your doctor. Practice proper hand hygiene all the time. Maintain social distancing. Clean surface areas.
The virus is literally everywhere, but we can still do something to prevent it from happening to us. Here are some of the preventive measures that we can do on our own.
Wear your face mask all the time. Wash your hands properly and regularly. Maintain social distancing. Most especially, avoid crowded areas.
Are you hesitating to take COVID-19 vaccine? Or are you concerned on where these vaccines came from? Or are you doubting about their efficacy? Well, there is no reason for you to be hesitant, concerned, or doubtful. Vaccines for COVID-19 went through many different studies and trials, which means that these vaccines are proven and tested. Regardless of where it was developed, a vaccine will help keep you from getting the virus. It is a safer way to help build protection. It will be an important tool to help stop the pandemic. What are you waiting for? Take any vaccine available in your area now.